Queens all day long since early morning, and you do have some incredible diners and visit a lot of your businesses and met some of our business owners, and just it's always so great to reconnect. And I've spent a lot of time here as lieutenant governor. I remember the borough president at the time, your predecessor, once said, "Are you sure you're not running against me? You're spending so much time in Queens." But I do love this borough. It is such a fascinating, diverse, exciting, a vital place. And this hospital, which had images splashed all over the nation and the world during the pandemic, as truly the epicenter of the pandemic, we've come a long way in healing. We are now saying that we may have been the epicenter of the pandemic, but now we're the epicenter of women's health. And that's what we're going to continue doing, is focusing on areas that we can make a huge difference, turn the page, heal the scars, as the CEO, great Helen, had told me as well. And so I want to thank everyone who was part of that really long journey to get us here today, but now there's no looking back. I am so optimistic about the future of this hospital. And Elmhurst Hospital is a level 3 perinatal center. That means, very simply, it is an absolutely critical provider of health for women and babies who require complex care. Thousands of families here depend on this hospital every single day. And what we want to do is make sure we deliver little bundles of joy instead of tears of anguish. The doctors and nurses here are second to none. They do extraordinary work. I just had a chance to thank a couple of them in the hallway, and they're just so energetic, and you can feel a real positive energy about this place. You don't always feel that. That is special. Everyone's working truly hard, but this building built many decades ago is just not kept up, right? It's just not giving you what you need. So let me describe what happens. Here on the ground, you know this, but if an expectant mother visits the women's pavilion and there's a problem, she needs to get to labor and delivery, right? Okay, where's she gonna go? She's gonna get rushed downstairs, put in an ambulance, driven around the corner to an emergency room, then go up to the labor and delivery unit. Now, I'm probably the only governor who could speak in a first-hand way about this, but when you're about to have a baby, you do not want to be going up and down stairs, trying to find an ambulance and driving around. Every second matters. Every second counts. And it's incredibly stressful and scary for everyone involved in that scenario. Think about that. The moms-to-be, the families and the staff, everybody's just stressed out. So I want to acknowledge some people who understand this challenge, why we're here today, who brought this to me directly. And our great CEO, Helen, you have been such a champion, such a fighter, but such a positive force of energy in this place, inspiring so many others. Helen, I want to thank you, Artie Aguilar-Diverti. I want to thank her for all she has done. She makes sure we know what she needs, right? And that's all right, that's all right. Also, Donovan Richards, again, we have become deep, deep friends for over a decade now. And to see you in action, the passion that you have toward the people of this borough is just so contagious. And it's so uplifting to see elected officials who understand the power they have to make a difference in people's lives. And you do that every single day. Ladies and gentlemen, our borough president, let's thank him as well. We have some great representatives in Albany as well. These are the people I work with. We roll up our sleeves. We get the job done. And Assembly Member Steve Raga is here. I want to thank Catalina Cruz, our Assembly Member here as well. Great champions of this area, both of you. I thank you for your service. And we have a number of our council members here, but also our cabinet member, James McDonald. Mr. McDonald, Dr. McDonald, are you here? There you are, Dr. McDonald. He is the head of the New York State Department of Health. Let's give him a round of applause. So because I heard from all of them, we're here today to announce a landmark $27.5 million investment to expand prenatal services, doubling the size of the Women's Health Pavilion. Finally building a brand new state-of-the-art pediatric intensive care unit and construct that long overdue, overdue is a word you hear in his place a lot, isn't it? Long overdue connecting the passageway to the 5th floor delivery suite. So this is what we're going to accomplish, and I want to thank everyone who helped make it happen. This will also help not just the people who come here, our patients, the workers, people involved in this entire healthcare ecosystem, which is just extraordinary, but also the neighbors. This will help the moms and the children in the neighborhood right here where they live. They know they can get this service. And you know what? When you invest in a building like this that has been here a long time, people just sort of take for granted it's always going to be this way. When you build new services, a new pavilion, you make those changes, it starts to change the psychology of people. I've seen this all over. You start putting up new buildings, you start making a difference, you start investing in facilities, and people realize, like, you know what? It's not happening somewhere else, it's happening right in my neighborhood. We must be important enough to have this. That's important to me as governor, because I want people to have a positive, upbeat feeling about their communities, their neighborhoods, and what their government can do for them. So this is how we start changing people's attitudes. And it's also not just about getting access to the new PICU, it's the children who'll get care in this community. Now, I'm all about kids. There's not a single child I've ever encountered in the entire state of New York that I have not reached over and tried to hug. I gravitate to children. It's just innate in me. And now I have a little 2-year-old granddaughter who I FaceTime every day. She doesn't live around here, but I get a chance to see her. So when I think about little faces like that and how innocent they are, and how we have to provide better care for them, starting before they're born. Okay, let's give them the best shot in life. We have to have more services for moms. We have to have programs in the evening. And this is all from the community, the women in the community. They're saying what they need, and we can provide this. And also, once the kids come, we have to make sure that they have every best shot in life. And that's why just this summer, my administration has announced over $500 million in investments and support for New York families with children. And that is what we're going to continue. That is extraordinary. It's personal. It's personal. So we've invested this money. We're investing in making sure that more women survive pregnancy. And I've heard from too many that say getting pregnant, if you're a woman of color, can be a death sentence. We did a lot of events on this. We had a very aggressive program in our State of the State address to talk about what we can do to reduce the horrifically high numbers of maternal and infant mortality here in the state of New York. Our numbers are disgraceful in this country compared to other countries. And I'm not going to tolerate that any longer, because everyone deserves the best shot in life. And so when you know that black women are 3 to 4 times more likely to die in childbirth, you have to peel back and say, what is going on here? What is causing this? And what I want to do is find every way possible to support these moms, get them through this, and to even have programs like the first state in the nation to offer paid leave for prenatal visits. Nobody else is doing that. This way we make sure that there's not a reason for a low-wage mom who has to leave her job and perhaps find childcare for other kids to go to those essential appointments. They're more likely to skip those appointments if they're not being paid for that time. They're going to be paid for that time. That is the law in New York State. It starts in January, and you heard it here first in your state. So I'm really proud of our legislature for helping accomplish that as well. Also, Elmhurst was one of the very first to receive funding for our abortion provider support fund back in 2022. Around the time of the Dobbs decision, we talked about how more people are going to need support here. Every woman in the state of New York needs to have the right to choose, but also those have to seek shelter and seek a safe harbor here in New York. Make sure that they do not have to ever go to another state. This is the place they'll be able to secure those services. So we also cover Medicaid coverage for doula services. This is another way we can promote safer, lower stress births and a transition for parents. I mean, this is incredible. This is incredible. And as I just said, I met some of our nurses here and thanked them. And I said, we have to make sure that our workforce knows they're valued, especially those who came through the pandemic. But we also want to keep retention numbers. We don't want to have to always be looking for more employees. It is a real challenge for our institutions. What a different world it is when I was growing up, everybody wanted to be a nurse or a teacher. That's what women did. There were plenty of people who wanted to be in these really essential jobs. and now we have fewer people looking for them and higher needs among our patients. So we're investing in our healthcare program, is why it launched in 2022 a program to provide $2 billion to give, to put directly in the pockets of 800,000 healthcare workers who were the front line workers. I know many of them are right here, and I know I was just getting some hugs in the hallway. They're very grateful that we can do this for them. So challenges, you can have a beautiful hospital, you can have beautiful new facilities, new wards, but if you don't have incredible people to work in it, then it doesn't all matter. It doesn't matter at all. So we're going to continue making a difference. And as a result of all these efforts, what we're doing right here in Queens, right here at Elmhurst, truly making a difference in the lives of others, I feel really proud. This is a proud day for me to be able to come here and look at all of you, the ones who live and breathe this place, because you're so dedicated to the best outcomes for your patients. You know why? You're in this profession because you care. The bottom line, you could have done anything with your lives. Everyone is sitting here because you care so deeply, and I want to thank you for all you do for all of us. I think I missed a couple of our council members who are here. Shakara Krishman, Councilmember Krishman's here as well. I want to thank you. Lynn Shulman has joined us as well, council members. And again, I have the best team, but you are so blessed here to have the most amazing CEO I've ever run into. She's a hugger. She's the kind of person I go to. Helen, I want to invite you up here. Land of Verde. I know, it's on.
As I wear BFFs now, so it's Helen all the way. So just now, I will cry, just letting you know that now. I'm so lost of words. My emotions really want to get the best of me. This commitment to women's health and our smallest patients is not only remarkable, but more important, when we talk about equitable care and access, that's what this investment means. I want to thank you and welcome you, Governor Hochul, to Queens, to our beloved neighborhood, one of the most diverse and culturally rich places in the planet. Yes. Here at Elmhurst, we speak more languages than Google. We not only stand for what's important, but we stand what's important for our community. Queens is one of the biggest counties by population and is home to over 2.2 million people. There's more people living in our borough than most major cities in America. And sadly, we do not have a public or truly comprehensive women's health center in our borough until now. So thank you. Given that Jackson Heights, Elmhurst, and Corona, we have the highest rates of births in all of New York City. This investment is not only needed, but necessary to really do a reduction in infant and maternal mortality rates. Research has shown over and over again that when a woman is able to understand her body, her hormones, her cycle, and her overall health, she is 3 times more likely to be confident, to stay in school, to reach out for that job promotion, to even dream of maybe becoming a hospital CEO, or maybe a New York State governor, or fingers crossed, the next woman president. Therefore, we're so happy that you're making our dreams come true through this amazing investment of $27.5 million to this hospital. Expanding the capacity of our Women's Pavilion allows us to condense all the services that we have here at Elmhurst. This year alone, we served over 65,000 women visits in our hospital. This will now put it in this amazing state-of-the-art location. From our teenagers to our young women seeking family planning, postpartum care, cancer services, hormone therapy, fertility treatment, menopause, and more importantly, we're going to have in this building mental health services designed specifically for women. This new expansion of space will provide critical services to our mothers, our sisters, our daughters, our abuelas, our tias, and more importantly, all the women of this beloved borough. Promoting women's health at every stage and at every age is ensuring equal quality access to care. This is something that we had once dreamed about, but now we're seeing it as a reality. To quote the Queen Bee, Beyonce, Who run the world? Girls. And with equitable access to healthcare, this statement could be true. And just when I couldn't stop crying and be even more excited, you included a $7.5 million investment in a brand new pediatric ICU. The future of, yes. The future of Queens also depends on our littlest patients, our children. As a mother, the most anxiety-driven moments of my life are when my children are sick. Not having a pediatric ICU has meant that many of our little children and most injured children from our community need to be transferred out of this borough and taken to other several hospitals away from their home. This past year alone, that was over 600 children that have been transferred out, and that's just counting Elmhurst and Queens Hospital. This was an unnecessary burden on many low-income parents and families, and you made that now a forgotten past. Those numbers are just enough to name a few. This investment will make sure that our little patients stay close to home, close to familia, close to their doctors, and more important, close to here, to Elmhurst, their home. I want to take this moment to acknowledge that this investment to our beloved hospital is a true testament to your commitment to public health systems. But it's also a statement of your belief of what this clinical team can do. This room is filled with clinical teams and operation leadership of this hospital who have spent thousands of hours to ensure that we provide excellent quality care to everyone that walks through our doors, regardless of race, sex, ethnicity. And our doors are big ones, because last year alone, we served over 1.1 million visits. I think that gets a high five. But this work cannot be done alone. I really want to thank my community tribe, which includes our beloved borough president, Donovan. When I tell Donovan about all of my crazy dreams, he doesn't laugh. He says, I think that's doable. And not only is it doable, but he also shows his wallet where his mouth is. So every time he comes, he's always willing to donate. And more important, to invest not only in the future of our beloved hospital, but of the borough. I can't thank enough Assemblymember Cruz, Assemblymember Raga, Councilman Shaker, Councilmember Lynn, Julissa Gutierrez, Julissa Ferreras, and everyone in this room. You make this $27.5 million investment not only a commitment of what we can do, but of what is to come. Governor Hochul, I can't imagine your schedule and the thousands of commitments and laws you need to address almost every day. But I hope when you hit your pillow tonight, know that this investment in this hospital would change lives. Because now that teenager or that menopausal woman in a hot flash is not walking alone anymore. She has a home, and a group of amazing doctors, nurses, and clinical teams that will help her and her family grow stronger. Mil gracias, Governor. I didn't cry too much. When I think of amazing women and amazing women fighting for women's rights, I can only think of this one person. Assemblymember Catalina Cruz not only is a fighter for our community, a fighter for women, but she's a fighter, period. So I really want to welcome her home, and welcome her up to the stage.
Buenas tardes. When Helen says, welcome me home, I'm a patient here. My family has come here, and I see several people who have saved the lives of my loved ones here. So thank you for that. And before I start an actual speech, can we get a round of applause for the amazing doctors, nurses, clinical team, and all of the folks here. You guys, we love Helen, but you guys make the world go round in this place, so thank you. I have the honor of representing this amazing hospital and the work that gets done here. And so I want to thank you from the bottom of my heart, Governor Hochul, not only for coming all the way to our neighborhood, but for investing in the future of our families, because that's what this is. It's 27 and a half million reasons why people should choose Elmhurst Hospital as their primary caregivers, as their OBGYN, as their mental health services, as the place where lives get saved. We saw these folks put everything on the line during the pandemic, and when we were speaking outside, one of the things that Helen said is, we want to now be seen differently. This is the start of that. And we thank you, and we will forever thank you for having saved the lives of so many neighbors. But it is now time to move from saving lives to ensuring that we're thriving in those lives. And that's what this healthcare and this money is going to help do. And so I'm just simply here to say thank you. You know, I don't think we ever got a governor to visit Elmhurst before. So I just want to highlight that. You know, this speaks volumes about your commitment, Governor, to everyday people. The majority of the people that walk through the doors at Elmhurst Hospital are folks who probably have nowhere else to go because they either are uninsured or underinsured. And Elmhurst Hospital does not ask what language you speak, can you pay? They only ask what hurts and how do we help you? And they make sure to save lives, they make sure to support folks, they make sure to have all those follow-up visits so that we can be healthy and live plentiful lives. And that is what Elmhurst will be known for from now on, the place where people come to make sure that they're now thriving. And so with that, I want to say thank you. I can't wait. I am a patient of the Women's Pavilion, so I can't wait to walk in and see what we do with all this money. And Donovan, don't worry about it. We still need your money. So don't think that this lets you off the hook. And Steven Raga and I, during next year's budget, will continue to do what we always do, which is advocate to ensure that this hospital isn't just fully funded, that it has that extra money that it needs to do all the amazing work that it does. And so with that, I want to introduce my neighbor and friend, Steven Raga.
No hug. Thanks so much, Assemblymember Cruz. Great partner that we have in Albany, like we mentioned, always fighting for our hospital and for our communities here. Thank you so much, Governor Hochul, for prioritizing our hospital here. My family was all patients. I've been a patient. My family and friends worked here. And like what was mentioned, the theme here is kind of turning the page. But it's so important to me and heartwarming that this investment is being made, that just a few years ago, especially folks that have lived in this area, I know Shaker and Carolina, you might remember at the darkest moments of the hospital, it's been the darkest moments of our city, of our state. And an investment like this, it's truly important that now we're going to see that our, like I said, our little ones, but are those that are the children that are most critical condition can get the medical care that they need. This is such a milestone in children's health here in our borough and across our neighborhoods here, and that our one-of-a-kind Women's Pavilion is being invested into to a level that our communities here can finally get that or get increased services that they need, the medical attention they need, and that safe space and competency that comes along with it in a space like this. So thank you so much, Helen, for spearheading these initiatives here. It's so important. And lastly, I just want to say that we have a great team, not just here, like everybody here at the hospital, but it's so wonderful to work all the way down from our city council members that are here, all the way to our borough president, of course, our members in the state legislature. But thank you so much again, Governor Hochul, for prioritizing the safety, the health, and also the livelihood of our hospital. This is going to change lives. It's going to save lives. So thank you so much. And it's my pleasure. In a day like this, of course, I'm the first one to say it, Queens get the money. And so here we have, coming on stage, happy to introduce our Queensborough President, Donovan Richards.
Clearly, Steven Raga got the memo wearing a green tie today, so Queens get the money, for real. But let me start off by thanking our governor. Thank you, Governor Hochul, for your leadership, not only in the state, but certainly in this county. And we started off our day very early with faith leaders. And I also want to acknowledge and thank the governor for also allocating $1 million towards mental health services to many nonprofits who do important work across this borough. So thank you for not only coming to Queens, and one of the things I appreciate about the relationship, and she spoke about our relationship going back over a decade, is that she's driven by results, not rhetoric. And that is important. And so we appreciate every time you come to Queens, you bring in your big wallet. Never be shy. Keep bringing that wallet. We're going to leave it a little lighter every time you come to Queens. But thank you so much for your leadership. To Helen, thank you. Let's give it up for our CEO. You know, it was not easy to guide this institution through the darkest days, as it was spoken about, of the pandemic. And you got to remember those scenes we all saw on the television screen. People wrapped around the block, people losing their lives in this neighborhood. I want to thank you and thank all of your staff, because you sacrificed a great deal. And on a day like this, I also remember my good friend Priscilla Carroll, who also passed away during that period. And to my colleagues, thank you. Catalina Cruz, thank you. A great leader in the Assembly, Stephen Raga. To my colleagues, both Councilmember Shulman and Shekhar Krishnan, thank you for your leadership as well. And I can't help but to feel such a sense of pride on this afternoon. And I'll tell you why. I feel pride in the healthcare heroes who come to work in this hospital each and every day to save lives. I feel pride in the leadership of this hospital with Helen at the heights, bringing it to new heights at this hospital. I feel pride because of the vision of Governor Hochul, who has worked every day to make quality health care more accessible to millions of New Yorkers. I feel pride because of my colleagues who do this work day in and day out. And I couldn't think of a more important time to spend money in maternal health. Think about the attacks on women nationally. This is a strong message that we send, that women's rights will not be under attack in New York State or in Queens County. That you have the right to choose, yes. Men, keep your hands out of the cookie jar. This is a woman's choice. Governor, once again, thank you for this incredible investment in this hospital, for your push to combat maternal mortality. And as it was mentioned, our nation faces a maternal mortality crisis among women of color. And many of those women of color reside right in this neighborhood. And let me be the first and not the last to say that your zip code, your socioeconomic status, or immigration status should not be a determinant on whether you have quality care and a quality facility that will be built right here in Elmhurst. So this $27.5 million investment, without a doubt, will save lives, and uplift countless families as they begin their journey through life together. And there's no reason that you should be born into a disparity. You're in your mom's womb, you're already facing disparities coming from neighborhoods like this. So this investment is going to certainly make a huge difference in saying that, you know what, the people of this community matter. The workers of this hospital who lay in and do this work day in and day out, yes, you deserve a quality facility like this. So that's what today is all about. Queens is certainly leading the way. Happy to have invested over $10 million in this hospital alone, $3 million going to support the PICU. But my wallet's not as big as the governor's. So I'm just happy to add on to $27.5 million. Wow. Thank you again, Governor Hochul. This day is your day. To the members of this community, of this hospital, this day is your patient's day. Thank you, and God bless you all. Queens get the money. Thank you, Governor Hochul.
Please remain seated while we take some photos.